What I have here is a model of a hip replacement. In my right hand here is the half of the pelvis. This is the symphysis pubis, or right in the midline, and this would be the bump on the outside that people frequently refer to as being their hip. So the replacement involves putting a new socket in and a new ball, and then the stem to hold that where it belongs, put the pieces together, and you get now new motion, but instead of having bone on bone or rough surface on a rough surface, you have a highly polished femoral head and a fancy plastic on the inside. The question that I'm asked frequently is, how long will it last? Well, this is an interesting question because we don't exactly know. What I mean by that is the replacements that were put in before about the year 2000, this plastic here was the weak link. The plastic would wear out and the plastic debris would spread into the joint capsule and the joint fluid. And the body would then try to digest the plastic, but we don't have the enzymes to do it. But in that attempt, instead it would digest all the bone around and the implants would come loose. The materials that have been available since about the turn of this century, though, are really, really good. And they have been bench tested for survivorship at a simulated 30 years worth of activity. And this is true both for hips and knees. And now they've been in people for a good 20 years. And so far it's living up to its hype. So now we can give people in their mid-50s, maybe early 50s, a hip or knee replacement and say that there's a very high chance that it will last the rest of their lifetime.